Shots fired, Spencer. Shots fired.
Drop the knife. Drop it now. An NYPD officer's voice cuts through the morning air, raw with urgency, as a routine patrol in Astoria, Queens, erupts into a deadly showdown. On April 14, 2025, a 911 call about a man with a knife spirals into a tragedy that claims the life of King Wong, a 60-year-old man lost in a mental health crisis. This is the story of a neighbor known for his quiet wanderings, a community left grieving, and a system that turned a cry for help into a fatal encounter. It's 6:20 a.m. in the heart of Astoria, under the shadow of the elevated 7 train tracks along 31st Street near 31st Avenue. The neighborhood is just stirring, the hum of early commuters blending with the clatter of trains overhead. King Wong, a 60-year-old resident of the NYCHA Woodside houses, steps out into the dawn. To those who knew him, King was a familiar figure, often seen rummaging through bins for scraps, his slight frame hunched from years of hardship. He was harmless, says Rhonda Ferguson, a neighbor who'd slip him sandwiches when she caught him scavenging. He'd fiddle with things, a screwdriver, a lock, but he never hurt anyone. He was just adrift after his parents passed. The recent deaths of his elderly mother and father, his lifelong caregivers, had left King untethered. His mental health struggles laid bare for the community to see. King's challenges were no secret. NYPD records note at least 2 prior calls labeled incidents of mental disorder involving him, though the details are murky. On this spring morning, something shifts. Witnesses spot King pacing the sidewalk, clutching a 14-inch kitchen knife, waving it in erratic, aimless arcs. Concerned passersby dial 911, their voices tense. "There's a man with a knife acting crazy." The calls flood the 114th precinct, and within minutes, Officers Acosta and Tavares race to the scene, their patrol car screeching to a stop at the intersection. Body-worn cameras flicker on, capturing every second of what's to come. The officers leap from their vehicle, using the car doors as shields against the glinting blade in King's hand.
Put the fucking knife down! Put the knife down! Put the knife fucking down! Put the knife down!
Put the knife down! Drop it! Acosta shouts, his command sharp and unyielding. King, his eyes distant, his movements jerky, seems trapped in his own world, unresponsive to the orders. The knife swings in slow, disjointed motions, not aimed at the officers, but a reflection of his inner turmoil. "Sir, drop the knife now!" Tavares echoes, his voice rising. The officers' pleas are met with silence, and the tension spikes. Tavares fires his taser, the prong sparking with a loud crack. King stumbles, the electric jolt grazing him, but the barbs don't fully connect. He shakes it off, gripping the knife tighter, and begins to shuffle away, heading south under the rumbling tracks. The officers trail him cautiously, their radios crackling with updates. "It didn't work. He's still moving," Acosta reports, urgency creeping into his voice. Moments later, backup arrives. Officers Coisy and LaMonica join the pursuit, their presence escalating the stakes. 4 armed officers now face King, forming a loose semicircle on the narrow street.
Put the knife down, sir! Put the fucking knife down!
Their commands overlap, a chaotic chorus. "Stop! Drop the weapon!" Coisy bellows. King pauses, then turns, his steps quickening toward the new arrivals. The knife rises, catching the morning light, and in that fleeting moment, the officers perceive a threat. "He's charging!" LaMonica yells. In an instant, the air explodes with gunfire, a dozen shots from the 4 officers' service weapons. The blasts echoing off the concrete pillars of the elevated tracks. King crumples to the ground, blood seeping onto the pavement, the knife slipping from his hand. The encounter, from the officer's arrival to the fatal shots, lasts just over 2 minutes. Paramedics swarm the scene, their sirens piercing the stunned silence. King is rushed to Elmhurst Hospital, but the wounds are too grave. By 7:15 a.m., he is pronounced dead, his life extinguished in a matter of moments. A 14-inch kitchen knife is recovered beside him, confirming the reports that drew police to the corner. But for those who knew King, that blade wasn't a weapon of intent. It was a symptom of a mind unraveling, a man crying out for help in the only way he knew how. Astoria reels in the aftermath. Outside Woodside houses, neighbors gather, their faces etched with sorrow and disbelief. Rhonda Ferguson shares stories of King's quiet kindness, how he'd mumble gratitude for a shared meal before vanishing into the dawn. He needed a doctor, not a gun, she says, tears streaming. Community leaders amplify the grief. City council members Julie Wan and Tiffany Caban take to the streets, condemning the NYPD's failure to de-escalate. This was a mental health call, not a SWAT mission, Caban declares, pointing to the absence of specialized crisis teams. The Coalition to End Companionship in Torture, CCIT NYC, joins the outcry, demanding a shift to public health responses. Send counselors, not cops with guns. King's family, cloaked in private grief, grapples with a loss that feels preventable. With his parents gone, who was left to advocate for his care? Experts like attorney Carolyn Reinach-Wolf point to a systemic gap. Adults with mental illness often lose their lifelines when aging guardians pass. New York City's Be Heard program, designed to pair EMTs and social workers for mental health 911 calls, could have been a lifeline, but it's reserved for non-violent crises, a distinction that left King in the hands of armed officers. The NYPD's own data paints a grim picture. In recent years, at least 20 people in mental health crises have died in police encounters across New York, with a dozen fatal shootings last year alone. On August 12, 2025, the New York Attorney General's Office of Special Investigation, OSI, releases the Bodycam footage, a move toward transparency that reignites public fury. The videos are raw, the taser's fleeting spark, the officer's shouted commands, the knife's erratic path, the deafening gunfire. For many, it's a montage of missed chances, no attempt to engage King beyond orders, no pause to assess his distress, no deployment of additional non-lethal tools. The release is not about guilt or innocence, Attorney General Letitia James states, but about building trust. Her office continues its probe, mandated to scrutinize every officer-involved death, but answers remain elusive. King Wong's death is a wound that Astoria, and the nation, cannot ignore. It's a story repeated too often. A man in crisis, a system unprepared, a life lost. Why do we send badges where counselors are needed? Why does a trembling hand with a knife meet bullets before understanding? The calls for reform grow louder. More crisis intervention training, expanded mental health response teams, protocols that prioritize life over lethal force. King deserved to walk home that morning, not to become a statistic. His life, fragile and human, mattered. This tragedy is a clarion call for change. From pilot programs like BHEARD to nationwide pushes for de-escalation, the path to better outcomes exists, but it demands commitment. If you or someone you know is struggling, call 988. The Suicide and Crisis Lifeline offers help without judgment. Share your thoughts below, and stay with us as we explore the stories that challenge us to do better. Thank you for listening.